Hello, guys, welcome back to another episode of my clinical learnings. So, this is the second video in this series, and to begin with, today in our OPD, the morning OPD of the CMP Medical College, Homeopathy, where I am currently interning. So, today we had nearly 62 patients in our OPD, and I took three new cases today, and from that three cases, I would like to discuss one case with you all. So it was a case of sciatica. One second. Yeah. So my clinical learnings episode 2, a case of left-sided sciatica. So before we begin, let me just make one point clear that sciatica is not a diagnosis but a symptom. And when we study the anatomy and its pathophysiology of the pain, we get to know that sciatica is a symptom and not a diagnosis per se. Okay. So like our earlier videos, we would like to begin with this topic by understanding little medicine part and the medicinal or the anatomical aspect of the sciatica pain. So generally the NCBI website is one of the most trusted website for medical informations. And now let us just look at to the introduction of sciatica. So let us begin. Sciatica is a debilitating condition in which the patient experiences pain and or paresthesias in the sciatic nerve distribution or an associated lumbosacral nerve root. Often, a common mistake is referring to any low back or radicular pain as sciatica. Sciatica is specific to the pain that is a direct result of sciatic nerve or sciatic nerve root pathology. The sciatic nerve is made up of the L4 through S2 nerve roots, with which coalesces at the pelvis to form the sciatic nerve. At up to 2 cm in diameter, the sciatic nerve is easily the largest nerve in the body. Sciatica pain is often worsened with the flexion of the lumbar spine, twisting, bending, or coughing. The sciatic nerve provides the direct motor function to the hamstrings, lower extremity adductors, and indirect motor function of the calf muscles, anterior lower leg muscles, and some intrinsic foot muscles. Also, indirectly through its terminal branches, the sciatic nerve provides a sensation to the posterior and lateral lower leg and plantar aspect of the foot. It is an important distinction to know that most cases of sciatica results from an inflammatory condition, alright, leading to an irritation of the sciatic nerve. Conversely, direct compression of the nerve leads to the more severe motor dysfunction, which is often not seen and, if present, would warrant a more meticulous and expeditious workup. The etiology: any condition that may structurally impact or compress the sciatic nerve may cause sciatica symptoms. The most common cause of sciatica is a herniated or a bulging lumbar intervertebral disc. In the elderly population, lumbar spinal stenosis may cause these symptoms as well. Spondylolisthesis or a relative misalignment of one vertebra related to another may also result in sciatica symptoms. Additionally, lumbar or pelvic muscular spasm and or inflammation may impinge a lumbar or sacral nerve root causing sciatic symptoms. A spinal or paraspinal mass including malignancy, epidural hematoma or epidural abscess may also cause a mass-like effect and sciatica symptoms. The epidemiology, we'll skip this part for the time being. The pathophysiology: the sciatic nerve is made up of the L4 through S2 nerve roots. These nerve roots fuse to create the large sciatic nerve in the pelvic cavity. So guys, you can just pause the video and read this anatomical region here along with the pathophysiology. So sciatica symptoms occur when there is pathology anywhere along this course of nerve. This pathology can be any conditions listed in the differential diagnosis. Okay, so history and physical, we can just read it, right? And the most important part which I wanted to focus upon is the differential diagnosis, right? So the differential diagnosis, a thorough differential list is important in considering a diagnosis of sciatica and should include herniated lumbosacral disc, muscle spasms, nerve root impingement, epidural abscess, epidural hematoma, tumor, Pott's disease, also known as spinal tuberculosis, and piriformis syndrome. So it's very important for us to differentially rule out why is the pain of sciatica occurring. Piriformis syndrome is again one of the most common cause and most common diagnosis which is generally made. Piriformis syndrome is a specific condition of special mention as it is often misdiagnosed and unrecognized. The piriformis muscles connect the sacral spine of the upper portions of the femur and aids in hip extension and leg rotation. Due to the proximity of the sciatica nerve, any injury or inflammation to the piriformis muscles can cause sciatica symptoms. Often overuse injuries, particularly in runners or other endurance athletes, causes inflammation of the piriformis muscle and have ensuing symptoms mimicking sciatica. Therefore, these patients tend to have increased pain from applying direct pressure to the piriformis muscle, increased pain when walking up inclines or stairs, and decreased range of motion of the hip joint. Piriformis specific stretches as well as hamstring stretches are helpful to release this muscle tension and to treat painful condition. Lumbar and sacroiliac manipulations may also prove beneficial for some patients. In addition, rest from the activity causing the pain is helpful. So, this was the basic introductory part of our sciatica case, and now we move into the homeopathy aspect. So, let me discuss this case with you all. So, whenever such cases do occur in our OPD, generally what has to be kept in mind is that the approach should be first symptomatic, like we discussed in the last video, and when the symptoms are alleviated, then maybe a constitutional to close the case. Okay, because generally the regional specific symptoms are quite easily taken. So the case went as LSMC. The pain nearly started from the hip region, traveling to the full course of sciatic nerve, right? So the patient came and complained of a constant pain from hip extending to the knees below to the calf muscles. Okay, so the pain stopped near the calves. In that, when I generally when we have these symptoms, then you go for the modalities, okay, and the sensation. So we elicited the location, then we have the sensation. Generally what he said was that there is a lot of dull aching. So he mentioned that there is this constant pain which is there throughout. So whenever there is a constant pain, generally we take it like a dull aching pain. But upon more investigation of the symptoms, I asked him to describe the type of pain which he was having. So upon more asking of the symptoms and sensation, हम I generally asked him in Hindi कि आपको किस टाइप का दर्द हो रहा है. So then he mentioned one word कि जैसे कि कोई खींच रहा है ना, so खिंचाव. So when generally we take खिंचाव into English translations, it comes up to the drawing pains which are generally associated in English language, right? So there is a drawing type of pain, and with that the side which was affected is left sided, which I have already mentioned here above. Left sided sciatica, case of left sided sciatica pain. And generally when asked upon his modalities, he said that generally he feels better when there is warm, and the sciatica pain is better by warm, and the sciatica pain is also better when he applies a lot of pressure, right? And the aggravating modalities again is from walking, and he even said that he can't squat. Squatting is nearly impossible. So the patient which came to our OPD was a security council, and they have this duty of hours long standing hour duty. In that They have to stand for long hours, which again can aggravate, so there is standing aggravation. And these are some of the modalities that I took into the case consideration. So after repertorizing, since I cannot write all the rubrics here, I'll just give you the common rubrics of the broad spectrum sciatica case, right? So the rubrics which I took into consideration is the general as well as particular together, okay, to see which remedy is covered the most. So we took into consideration extremities pain lower limb, extremities pain lower limb left, extremities pain lower limb sciatica nerve left, extremities pain lower limb sciatica nerve which is aggravated in the afternoon, which is said that the pain is more in the afternoon, and extremities pain lower limb sciatic nerve which is night aggravation. Then again we take extremities pain lower limbs walking aggravate, extremities pain lower limb warmth ameliorate, extremities pain lower limb extending downwards from hip to knee. Okay, so when we take all these rubrics, the remedy which covers the most symptoms is colosynth. And to just correlate and compare colosynth from our materia medica, we go to the Borik's materia medica. In that we go to the extremities part, and in that Dr. Borik has written sciatic pain left side, specifically sciatic pain left side. So we have number 1 and number 2 in the totality. Then the pain is of drawing type. So drawing type which is again the खिंचाव, the खींचने जैसा जो पेन होता है वो इसमें कवर हो रहा था in colosynth from Borik's materia medica. The patient is better by pressure and heat. So we have the modalities as well, ameliorating modalities of heat and pressure, which I have already taken in the repertory totality, and worse by gentle touch. So contraction of the muscles, pain down right thigh muscles and tendons feel too short, numbness with pain, pain in the left knee joint. So in this we can again compare nephilum in the comparison part. So after covering the Borik's materia medica, let us go to the Phatak sir's materia medica and see what Phatak sir has to say in extremities chapter. So Dr. Phatak mentions that contraction of muscles, sciatic pain, shooting, band-like screwing better by pressure, and heat worse by least motion, rotation at night, limbs drawn up like hedgehog, cramps in muscles during coition, pain in deltoid right, knees feel stiff, cold, feet cold with colic. And some of the modalities of the remedy colosynth is, we need to remember for our further homeopathic knowledge that colosynth, right, is worse by emotions, indignations, vexations, chagrin, anger. He's also worse by lying on the painless side, which is again a very keynote of colosynth. Lying on the painless side nearly worsens the symptoms. Night aggravation in bed draughts by taking cold before and after urination, and the patient is generally better by heart pressure. Then the patient is again better by heat, rest, which was there again in the case, and gentle motion. After stool of flatus doubling up, right? So this was the part from our Phatak sir's materia medica. And now coming back to the last part of the video, wherein we cover the specific rubrics from our specific repertories, right? So in the Kent repertory, we have extremities pain, lower limbs, and sciatica. So in that, let us check the rubric. So the important 3-marker remedies which we have in here are bryonia, buffo, colosynth. Okay guys, so colosynth is covered in our Kent repertory as well. Then we have iris, kali iode, mag, phos, nux vomica, rustox, and tellurium. So guys, we need to remember that these are the important 3-marker remedies according to Dr. Kent, and in that too again magphos is again a near specific for sciatic nerve pain along with kali iode, which has a great affinity. But after all, we need to clearly differentiate between colosynthis, magphos, kali iode, and bryonia. Now let us check if any other doctors have given any specific rubric for our sciatic pain. So again we have in our Boric Sir's Materia Medica, Boric. So the rubric given in Dr. Boric's Materia Medica is in nervous system for sciatica. So this can again be asked as an MCQ. So in nervous system chapter we have sciatica nerve pain, and in that we have 58 remedies. Okay, the important 3 marker remedies we list are aconite, ammonium mure, arsenic alb, belladonna, chamomilla, collinsonia canadensis, ginseng, naphyllum, ignatia, indigo, iris, kali iode, phytolacca, rustox, plumbago, ruta, sulfur, and viscum album. Okay guys, so see how repertories differ from author to author. So the remedy which was given 3 mark in sciatica colocynth is not even mentioned in the Boric's Materia Medica Boric's repertory. And then finally we end our, you know, by referring Dr. Phatak sir's repertory. So let me just browse for you all Dr. Phatak sir's repertory. Yeah, so in Dr. Phatak sir's repertory, since it's an alphabetic repertory, the rubric comes under section S, letter S, and in that again we have 2 important 3 mark remedies given by Dr. Phatak, which is again colocynth, 3 mark, and rustox is 3 marks, right? Because rustox is anyways covered, which is better by warm aggravation, better by initial motion, and rustox nearly like helps in all complaints of pain, especially in the lower limbs and the back. But again the 2 mark remedy which Dr. Phatak sir mentioned is Nux vomica and tellurium. Okay, so with this guys we have covered some important rubrics of the sciatica case analysis. In such cases of sciatica, what we generally do is that take the local symptoms first, and what I have given you in this video is the comparison of 3 repertories, broad spectrum rubrics of sciatica, and you can always enhance your knowledge by differentiating them. And if you can differentiate them for me in the comments, let us know, let us know by commenting that how the pains of colocynth differs from rustox in the modalities, in the sensation, right? And like how the sciatica nerve pain usually presents in other remedies. And if you all have any clinical symptoms which you need to share with us, we are always welcome for you all to share your clinical experiences. If you need to share your cases with us through our platform Med Perspect, I'll be sharing my mobile number with you all, so you can WhatsApp me on 8454843131. This is my WhatsApp number and we can connect. So any cases that you have seen, share, which you would like to share with other doctors and other students especially, because this whole series is an inspirational series for students and a learning series as well for those who do not have that hang of seeing patients in OPD basis. It's series for them so that even they can learn some aspects of homeopathy. And because we all know that every doctor in homeopathy practices differently, even though the laws of similar are very same, but the practice of doctors differs from person to person, right? And it's quite fascinating that how there are A to Z routes, but if done properly they all lead to only one cure, and which is again our highest ideal, to cure the patient, right? The aphorism 1. So with that said guys, I will end this video. The topic, general discussion of topic was sciatica. We saw the general introduction, and again we saw the homeopathic approach and homeopathic part with it. So thank you so much for being with us, and please do like, share and subscribe. It will motivate us to make more and more such videos for you all. Thank you so much. Goodbye, take care, God bless you all.